The rain did not tap against the glass of Trauma Bay 1. It hammered. A relentless, drowning rhythm that matched the chaos inside. Verena stood by the crash cart, hands clasped, eyes lowered. She was 55, perhaps older. Her scrubs were a generic, washed-out blue, a size too large for her frame. She had been at St. Jude's Level 1 Trauma Center for exactly 6 hours. Nobody had asked her name. To the high-octane residency team, she was just a shadow in the corner, a warm body sent by the agency to plug a hole in the schedule. Dr. Sterling, the chief resident, snapped his latex gloves. The sound was like a pistol crack in the small room. He looked at the monitor, then at Verena. "Hey, new girl," Sterling said, not unkindly, but with that specific, sharp tone reserved for the invisible. "Try to keep up tonight. This isn't the nursing home. We move fast here." The two interns chuckled. It wasn't a mean laugh. It was worse. It was dismissive. They were laughing at the idea of her. Verena didn't blink. She didn't stiffen. She simply nodded once. A slow, measured dip of her chin. "Understood, doctor," she said. Her voice was low. "Gravel and honey." Sterling turned his back to her, already forgetting she existed. "All right, listen up." He barked at the room. "Incoming is 5 minutes out. Multi-system traumat. High velocity. If you hesitate, people die. If you freeze, get out of my bay." Verena stepped forward to the instrument tray. She reached for the laryngoscope. Her movement was barely a ripple in the air. She checked the bulb. It flickered. Without a word, she replaced the batteries, tested the light, and set it back down at a precise 45-degree angle. She did not check the list. She did not ask permission. She adjusted the suction canister pressure. She lined up 3 vials of epinephrine, caps already popped, but hidden behind the saline bags. Sterling turned back around. "Why is the scope moved?" he asked, annoyed. "It was dead," Verena said. Softly, Sterling scoffed. "It was fine this morning. Don't touch my tray unless I ask." He moved it back to its original, unready position. Verena said nothing. She stepped back into the shadows. The red phone on the wall buzzed. A harsh, jagged ring. The charge nurse picked it up, listened for 3 seconds, and went pale. "ETA is now 1 minute," the nurse shouted. "It's not a car crash." The room went silent. "What is it?" Sterling demanded. "Military transport," the nurse said, voice trembling. "Chopper is touching down on the roof. They bypassed the naval hospital. Patient is a high-value asset. Critical." The double doors at the end of the hall slammed open. Wind from the rotors outside swirled into the corridor, smelling of aviation fuel and wet concrete. The noise hit them first, not screams. Orders barking rhythmic, violent orders. Verena shifted her weight. For a split second, her left hand went to her own shoulder, rubbing a spot beneath the blue scrub top where no scar should be. It was a reflex. A muscle memory triggered by the sound of rotor wash. Sterling didn't see it. He was too busy shouting for units of O negative. But the way Verena stood changed. The slump was gone. Her spine was a steel rod. She watched the doors, not with fear, but with a terrifying, focused calm. The gurney crashed into the room. The men who brought him in were not paramedics. They wore muddy fatigues. No name tapes. No unit patches, just hook and loop Velcro where the identity should be. They moved with a terrifying economy of motion. 2 of them lifted the patient onto the trauma bed. They didn't count to 3. They just moved as one organism. The patient was massive, a wall of muscle and scar tissue, now shredded by shrapnel. He was unconscious. Gray. Blood pooled on the floor immediately. It was too dark, too fast. "I need everyone back," Sterling shouted, his voice cracking just a fraction. "Trauma shears." No, he grabbed the scissors and began cutting through the tactical vest. The nylon was thick. Kevlar. Ceramic plating. Sterling struggled. His hands were shaking. Just a tremor. Verena was already there. She didn't reach for the scissors. She reached for the quick release tab hidden under the left shoulder strap. A mechanism most civilians would never notice. Click. The heavy vest fell away instantly. Sterling blinked, confused, but didn't stop to ask how it happened. Airway is compromised. The lead military escort growled. He was young, bearded, his eyes wide with a suppressed panic. He took a blast wave to the chest. "Don't mess this up." "I know how to do my job, Sergeant." Sterling snapped. He grabbed the laryngoscope, the one Verena had fixed. He tilted the patient's head back. Throat is swollen. Sterling muttered. "Can't see the cords." "Suction." He held out his hand blindly. An intern fumbled for the suction wand, dropping it on the sterile field. "Damn it!" Sterling yelled. Before the intern could apologize, a hand slid into Sterling's view. Dark skin, short, clean nails. Verena placed a smaller, curved blade into his palm, a difficult tool. A pediatric size. "Too small," Sterling hissed. "He has a blast collar injury," Verena said. Her voice cut through the noise. "Not loud. Just heavy. The swelling is low. You need the angle?" Sterling hesitated, began to scream. Oxygen saturation dropped, 88%, 85. The military escort took a step toward the table. His hand drifted toward his belt. It was a subtle shift. A transfer of authority. He no longer looked at the doctor. He looked at the monitor. Sterling felt the heat of the soldiers behind him. He didn't argue. He swapped the blade. He slid the smaller scope into the throat. He leaned in. "I see them," Sterling whispered. "I'm in." He passed the tube. The chest rose. The room exhaled. But Verena didn't relax. She was watching the patient's hands. The unconscious commander's fingers were twitching. Not a spasm, a rhythm. Tap, tap, tap. Tap. Sterling turned to the nurse, wiping sweat from his forehead with his shoulder. "Good guess on the blade," he said, breathless. "Next time, wait for the order." He turned back to the chart. "Get a central line in. He's hypertensive." The team swarmed the chest. Verena stayed at the foot of the bed. She watched the tapping fingers. She recognized the pattern. It wasn't a seizure. She moved closer to the soldier standing guard, the young one with the beard. She didn't look at him. She looked at the floor, mopping a blood splatter with her shoe. "He isn't out," Verena whispered. The soldier stiffened. He looked down at her. "What?" "Your commander," she said, still looking at the floor. "He's tapping out a code on his thigh. He can hear us." The soldier looked at the bed. Tap, 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 tap. The soldier's face went white. He looked at Verena, really looked at her. For the first time, the invisibility flickered. "That's impossible," the soldier said, his sedated. "There's fighting the sedative," Verena said. "And he's in pain. Tell the doctor to check the left leg. The tourniquet is too high." The soldier hesitated. He looked at the high-powered trauma surgeon. Then he looked at the quiet woman in the baggy scrubs. "Doc!" the soldier barked. Sterling spun around. "Check the left leg," the soldier ordered. His voice left no room for debate. Sterling scoffed. "The leg is fine. The trauma is thoracic. Check." "The leg," a Sterling groaned, grabbed a pair of shears and ripped the pant leg of the patient's uniform. Silence. "My God," the intern whispered. The tourniquet was not just tight. It was placed directly over a compound fracture. Every heartbeat rammed a jagged edge of femur into the sciatic nerve. The room recoiled. "Jesus," Sterling hissed. "Cut it." He worked fast. The arrogance evaporated, replaced by the mechanic's desperation. He clamped the bleeder. He reset the bone with a sickening grind. Blood stopped pooling. The monitor, which had been screaming a low tone warning, suddenly changed pitch. Beep, beep, beep. Steady. Green numbers stopped falling. Pressure is normalizing, the nurse called out. 110/70. A Sterling dropped the bloody instruments onto the metal tray. Clang. He exhaled a long, shaky breath that fogged his face shield. "We got him," Sterling said. He looked at the soldier. "Good catch, Sergeant." That leg would have killed him from shock in another 2 minutes. The soldier didn't say thank you. He didn't nod. He turned his head slowly toward the corner, toward the sink. Verena was there. She was scrubbing blood off her forearms. The water ran pink. She didn't look up. She was scrubbing with a rough, practiced intensity. The soldier walked over to her. His boots squeaked on the linoleum. He stood too close. It was an interrogation stance. "You read the tap," the soldier said. His voice was a low rumble, under the noise of the room. Verena turned off the faucet. She dried her hands with a paper towel. Slowly. "I saw a patient in distress," she said. Her voice was flat. "Pain makes people twitch." "That wasn't a twitch," the soldier whispered. "That was a check fire cadence." 3 taps. Pause. 3 taps. Verena threw the paper towel in the bin. "I don't know what that means, sir. I just changed the IV bags." She tried to step around him. He blocked her path. "Who are you?" "Verena," she said. "I'm the agency nurse. I'm here until 7. "That's not what I asked." "Sergeant," Sterling yelled from the bedside. "Clear the way. We're moving him to CT. He's stable." A stable, the word hung in the air. A lie wrapped in hope. The soldier stepped back, eyes still locked on Verena. The team unlocked the wheels of the gurney. "Let's move," Sterling ordered. "On my count. 1, 2. The commander's eyes snapped open. They were blue, ice blue, and terrifyingly clear. He didn't groan. He launched. His right hand, the uninjured one, shot out like a cobra strike. He grabbed the intern by the throat. "Whoa!" Sterling shouted. "Hold him down." The intern gagged, feet kicking the floor. The commander's grip was iron. "He's combative!" The charged nurse screamed, pushing 50 of propofol. "No," the soldier roared. "Don't drug him! He thinks he's captured!" "Chaos!" 3 orderlies rushed the bed. They grabbed the commander's limbs. The commander roared, a sound that was pure animal instinct. He bucked, throwing a 200-pound orderly into the crash cart. Glass shattered. Sterling grabbed a syringe. "I'm sedating him! He's going to rip his sutures!" Wet. Verena moved. She didn't run. She didn't shout. She walked straight into the kill zone. She stepped between the panicked intern and the thrashing SEAL. "Move," she said to the intern. She didn't pull the commander's hand away. She placed her own hand over his eyes. A strange, gentle darkness. She leaned in, close to his ear. Too close for safety. She didn't say, "It's okay." She didn't say, "Calm down." She whispered 3 words. Green side out. The effect was instantaneous. The commander froze. His grip on the intern loosened. The intern scrambled back, gasping for air. The commander's breathing hitched. He shuddered once. Then, his hand dropped. He didn't pass out. He just stopped fighting. He lay there, chest heaving, staring blindly at the ceiling. The room was dead silent. Sterling stood there, the needle uncapped in his hand, looking like a fool. "What did you say to him?" Sterling demanded. Verena stepped back. She smoothed the front of her oversized scrubs. "I told him he was safe." She lied. She looked at the monitor. "His heart rate is down. You can take him to CT now." Sterling looked at the monitor. She was right. The rhythm was perfect. He looked at Verena with a mixture of confusion and annoyance. "Right," Sterling muttered, "Let's go." Before he wakes up again, they wheeled the gurney out. The young soldier stayed behind for a second. He looked at Verena. He looked at the way she stood, feet shoulder width apart, hands loose at her sides. He knew, green side out. The soldier whispered to himself. He turned and ran after the gurney. Verena was alone in the trauma bay. She looked at her hand, the one that had covered the commander's eyes. It was trembling. She made a fist. Tight. Until the shaking stopped. The adrenaline in the trauma bay evaporated. It left behind the smell of bleach and copper. Verena did not follow the team to CT. That was not her place. She stayed behind to wipe down the mat. She replaced the suction liners. She restocked the gauze. Her movements were mechanical, efficient. She was erasing the evidence of the fight, just as she tried to erase herself. Dr. Sterling returned alone. He looked deflated. The rush was over, and now his ego was throbbing in time with his pulse. He watched Verena for a moment. She was scrubbing the sink again. "You stepped out of line," Sterling said. He didn't shout. He leaned against the doorframe, crossing his arms. Verena didn't stop scrubbing. He was going to hurt the intern. "Doctor, you touched a patient without an order. You whispered something to him. That's a liability." Sterling walked into the room. He kicked the brake on the gurney. A petty, loud noise. "What did you say to him?" "Really?" Verena turned. She dried her hands. The paper towel crumbled into a tight white ball in her fist. "I told him to breathe," she said. Sterling laughed. A dry, humorless sound, green side out. That means breathe. "It's a visualization technique," Verena said. Her face was a mask of polite boredom. "For anxiety." Sterling stared at her. He was looking for the lie. He knew it was there, buried under the baggy scrubs and the grey hair. "Your agency," Sterling said, narrowing his eyes. "Where were you before St. Jude's, the VA prison ward?" "Here and there," Verena said. She moved to push the crash cart back to the wall. "Leave it," a voice said from the doorway. It wasn't Sterling. It was the soldier. Kyle. He was still wearing his gear, but he had taken off his helmet. His hair was matted with sweat. His eyes were red, rimmed. He wasn't looking at Sterling. He was looking at Verena's boots. They were standard, issue nursing clogs, white. Rubber, but she didn't walk like she was wearing clogs. She walked heel to toe. Silent. "Sergeant?" Sterling said, straightening up. "How is the commander?" Kyle ignored him. He walked past the doctor. He stopped 3 feet from Verena. The air in the room grew heavy, compressed. "He's awake," Cal said. Verena looked at her shoes. "That's good," she said. The sedation must have worn off fast. "He's asking for the operator," Cal said. Sterling blinked. "The operator. We called the hospital operator to page neuro. No," Cal said. His voice dropped an octave. "He's asking for the operator, who checked his 6. Verena didn't react, but her right hand twitched. Just once, she tucked it into her pocket. "I think he's confused, Sergeant," Verena said softly. "Head trauma does that." Kyle took a step closer. He remembers the voice. He remembers the grip. A KL reached into his pocket. He pulled out a small, blood-stained notebook. The commander's dope book. He opened it to the back page. He wrote this down before they intubated him again. Kale held the notebook up. The scrawl was shaky, barely legible. "Find the ghost." Sterling looked at the page, then at Verena. "Ghost," Sterling scoffed. "He's hallucinating." Verena looked at the notebook. For the first time, her shoulders sagged. The invisible weight she carried seemed to double. She looked tired. Not shift work tired. Soul tired. "I need to check the inventory and supply," Verena said. She tried to walk past Kyle. Kyle didn't move. I checked your file. Verena, Kel said. She stopped. It's thin, Kel continued. Agency nurse for 3 years. Before that, nothing. I took time off, she said. To raise a family. No, Kel said. You didn't. He looked at her hands. You don't have a wedding ring tan line. You don't have pictures in your locker. And you know how to release a quick release plate carrier with one hand in the dark. Sterling looked back and forth between them. The dynamic had shifted. He was no longer the boss. He was the spectator. Who are you? Sterling asked, his voice losing its edge. Verena looked up. Her eyes were dark, deep. She looked at Cale with a mixture of sadness and warning. I'm the nurse who saved his leg, she said. And if you don't let me pass, I'm the nurse who walks out that door and leaves you short-staffed on a Friday night. Kale held her gaze. He saw it then. The fracture, the tiny hairline crack in the porcelain. It wasn't fear. It was grief. He stepped aside. Commander Vance is in ICU bed 4, Cal said. He won't let the neurosurgeon touch him until you come up. Verena paused. Tell him I'm busy, she said. She walked out. Her pace was steady. But as she turned the corner, out of sight, she leaned against the cold tile wall. She closed her eyes. She pressed her hand against her chest, over the spot where her heart beat too fast. She breathed in. Green side out, she whispered to the empty hall. But she didn't feel safe. She felt found. The ICU was a glass cage. Inside, the silence of the hospital floor shattered. Code blue. Bed 4. Verena was restocking the cart in the hallway. She heard the rhythm on the overhead monitor before the alarm sounded. Ventricular tachycardia. Fast. Wide. Deadly. She dropped the box of saline. It hit the floor with a heavy thud. She didn't pick it up. She ran. Not the hospital shuffle run. She sprinted. Inside the room, it was a slaughterhouse of good intentions. Sterling was there, shouting over the alarm. Charging to 200! Clear. The body on the bed jolted. Vance slammed back against the mattress. No conversion! The nurse screamed, still in V-tac. Again, Sterling yelled. 300. Cale was in the corner, being held back by 2 security guards. He was screaming something, but the noise swallowed it. Verena didn't look at the monitor. She looked at the floor. Blood. Bright red. Arterial. It wasn't coming from the leg or the chest. It was soaking through the sheet near the groin. A junctional bleed. The femoral artery had blown. The shock wave from the blast had weakened the vessel wall, and the pressure of the code had ruptured it. They were shocking a man who was empty. Stop, Verena yelled. The sound tore her throat. Sterling turned, paddles in hand. Get out! We're coding! You're killing him! Verena didn't stop at the door. She crossed the threshold. She didn't go to the cart. She didn't go to the IV pump. She went to the bed. He's bleeding out, she shouted. Look at the sheets. Sterling looked down. The white linen was now a heavy, dark crimson swamp. Oh God, Sterling froze. Femoral blowout. Get pressure! Someone get pressure. An intern reached out with 2 gloved hands, pressing tentatively on the wound. Harder! Sterling screamed. I can't find the source! The intern cried. There's too much blood. Vance's eyes rolled back. The monitor screamed a flatline warning. Verena shoved the intern. Hard. The kid flew back against the ventilator. Verena didn't use her hands. She jumped. She vaulted onto the bed, straddling the dying commander's hips. Her knee drove down into his groin. It was violent. It was precise. She put her entire body weight, 140 pounds, into the point of her right knee, pinning the artery against the pelvic bone, the combat kneel. A move illegal in every nursing handbook in the civilized world. A move taught only in the mud. Clear. Verena barked. She looked at Sterling. "Shock him now! I have the leak!" Sterling stared at her. A middle-aged woman in oversized scrubs, perched like a gargoyle on his patient, her knee buried in an open wound. "Do it," Cal roared from the corner. Sterling charged the paddles. Clear. Whoomp. Vance's body arched under Verena. She rode the convulsion, her knee never slipping. Not an inch. She was an anchor. The monitor went silent. Then, beep, beep, sinus rhythm. "We have a pulse," the respiratory therapist whispered. "Strong." Verena didn't move. She stayed on top of him, sweat dripping from her chin onto his chest. She kept the pressure. The room was frozen. Nobody moved to help her down. They were too stunned. Slowly, Vance's eyes opened. They weren't hazy anymore. They were sharp. He looked up. He saw the face hovering above him. He saw the gray hair, the tired eyes. But he didn't see a nurse. He looked at the position of her knee, the tactical lock of her hips. He reached up. His hand was weak, shaking, covered in his own blood. He didn't push her away. He grabbed the collar of her scrub top. He pulled her down just an inch. The room held its breath. Vance rasped. It wasn't a question. "I thought you died in Kandahar." Verena closed her eyes. The mask lay in pieces on the floor, shattered by the truth. She opened her eyes. She didn't pull away. "I did," she whispered. "No, let go, Commander. You're bleeding on my uniform." Verena slid off the bed. Her movements were no longer fluid. They were stiff, heavy. The adrenaline dump hit her all at once. Her hands began to shake again. She didn't look at the commander. She didn't look at the team. She looked at the blood on her knee. It was a dark, wet stain on the faded blue fabric. "Vascular is on the way," Sterling whispered. He was staring at Verena's leg. He wasn't looking at the stain. He was looking at the technique. He had seen that move once before, in a training video for battlefield extraction. A video that was classified. "You," Sterling said. His voice was hollow. "You aren't agency." Verena walked to the sink. She turned on the water. Cold, she splashed it on her face, trying to wash away the heat of the moment. "I'm a nurse, doctor," she said through the towel. "I'm just a nurse." "No," Cale said. The soldier stepped forward. The anger was gone from his face, replaced by something terrified, something reverent. "She's the ghost," Cal said to the room. The nurses stopped charting. The interns stopped cleaning. "What does that mean?" Sterling asked. Cale looked at Verena's back. 10 years ago, Kandahar province. There was a rumor about a medic attached to the darkest units, a woman who could start an IV in a sandstorm, who could hold pressure on a severed artery for 6 hours while the chopper took fire. Verena turned off the water. She gripped the edge of the sink until her knuckles turned white. "They said she died." Cale continued softly, "during the extraction of a downed pilot. The convoy was hit. No survivors were found." Verena turned around. She looked old. Tired, not like a warrior, like a grandmother who had seen too much. "The pilot lived," she said. Her voice was barely audible. "He lived because I put him in a root cellar and covered the door with dirt. I waited 3 days for the patrol to leave." The room went absolute zero. Sterling looked at her. He looked at the way he had spoken to her for 6 hours, the new girl, the urgency higher. He felt sick. "Verena," Sterling said. "Don't," she said. She held up a hand. "Please. I just want to finish my shift." She walked toward the door. She kept her head down. She wanted to disappear. That was her skill. That was her survival. But the door was blocked. Not by Carl, by the hallway. The glass wall of the ICU was lined with them. 6 men. They were the rest of the unit. The ones who had arrived on the second chopper. They were dirty. Bloody, exhausted, they had been watching through the glass. They had seen the code. They had seen the kneel. They knew the legend. And now they saw the face. Verena stopped. She couldn't walk past them. There were too many. One of them, a giant of a man with a bandaged head, stepped into the doorway. He didn't speak. He didn't cheer. He slowly, painfully, brought his heels together. He raised his right hand, schlop, precise, a salute, then the man next to him, then Cale. Then, from the bed behind her, a rustle of sheets. Verena turned. Commander Vance was awake. He was pale. He was wired to a dozen machines, but he was looking at her. He couldn't lift his arm. It was strapped down, so he lifted his chin. A nod. A single warrior's nod. The monitor beeped steadily in the background. Sterling stood against the wall, shrinking. He realized then that he was the smallest person in the room. Verena looked at the men. She didn't salute back. She wasn't an officer anymore. She wasn't a soldier. She was a nurse. She pressed her lips together to stop them from trembling. She nodded once to the commander. And then she walked through the gauntlet of salutes. Shoulders hunched. Eyes on the floor. Carrying the weight of a ghost who was supposed to be dead. The sun did not break through the clouds at 7 a.m. The rain had just turned to a cold, grey mist. The shift change was a different kind of noise. Less urgency. More exhaustion. Verena stood in the locker room. She peeled the scrub top off. It was heavy. Stiff with dried blood, she rolled it into a tight ball. She didn't throw it in the laundry chute. She held it for a moment. The fabric was cheap. The color was ugly. But it had held the line. She put on her street clothes. A grey wool sweater, comfortable slacks, shoes that didn't squeak. She looked in the small, rusted mirror inside her locker door. The woman staring back wasn't the ghost of Kandahar. She was just Verena. She had bags under her eyes. Her hair was messy. She looked ordinary. And for the first time in 10 years, that didn't feel like a punishment. It felt like a disguise that had become the truth. She closed the locker. Metal on metal. Verena. She didn't jump. Dr. Sterling was standing at the entrance of the locker room. He wasn't wearing his white coat. He held a cup of coffee. 2 cups. He looked awkward, stripped of his authority. He held one out. "Black," he said. 2 sugars, I asked the charge nurse. Verena took the cup. The warmth seeped into her cold fingers. "Thank you, doctor." Sterling looked at his shoes. Expensive leather, now scuffed. "I called the agency," he said quietly. "I told them to cancel your rotation." Verena stiffened. She gripped the cup. "See," she said. "I understood the liability concerns." "No," Sterling interrupted. He looked up. His eyes were red. He hadn't slept either. "I told them to cancel it because I'm offering you a permanent line. Trauma lead, night shift." Verena blew on the coffee. Steam rose, hiding her face. "I'm expensive, doctor. I don't care," Sterling said. "I don't want a nurse who just follows orders. I want the nurse who knows when I'm wrong." He paused. "I want the one they saluted." Verena took a sip. It was too sweet. She hated sugar. But she drank it anyway. "I can't take the lead," she said softly. "Why not? You're overqualified. You're a legend. Legends are for campfires." Verena said. "They don't empty bedpans. They don't hold the hand of a dying junkie at 3 a.m. when there's no glory in it." She stepped past him. "I like the shadows," she whispered. "The work is honest there." Sterling didn't argue. He stepped back. He held the door open for her. He didn't say, "Good work." He said, "Thank you, ma'am." Verena walked out. The hospital lobby was busy. People rushed past her. Visitors, delivery men, patients. Nobody looked at her. Nobody saw the reflex speed in her step. Nobody saw the scar on her shoulder. Nobody knew that 6 hours ago, she had saved a commander with a knee and a whisper. To them, she was just an older woman with a heavy bag, waiting for the bus. She walked out into the mist. She didn't put up an umbrella. She let the rain touch her face. It felt real. She thought about the commander. He would live. He would go back to the fight. She would not. Her fight was here, in the quiet, in the unseen moments between the heartbeats. She didn't need the medal. She didn't need the salute. She had the work. And the work was enough. Being invisible didn't mean she wasn't there. It just meant she was the foundation. Verena smiled just a little as the bus pulled up. She climbed the steps, paid her fare, and took the seat in the back. She closed her eyes. And finally, she breathed. Green side out. Thank you for listening to this story with me. Your time is the most valuable thing you own, and I am grateful you spent it here. If this story reminded you of a quiet hero in your own life, I would be honored if you shared it with them.